Hi, my name is Kayla. I'm going to be doing a wound culture today. I'm going to follow all GPSP guidelines, and if they have not been given their pain medication prior to doing this, I will follow the 3 med checks and the 11 rights. I'm going to knock and introduce myself. Hi, my name is Kayla. I'm going to be your nurse today. I'm going to be getting a wound culture from your surgical wound on your abdomen. What's your name and date of birth? Check that. That's correct. Do you have any allergies? No allergies. Your MAR says that you received your pain medicine about an hour ago. What would you rate your pain right now, 1 out of 10? They rated it a 2. So is it okay if I go ahead and get this culture? They said yeah. I'm going to perform hand hygiene and put on gloves. I'm going to remove this dressing using the push and pull method, and if it was giving me any trouble, I would apply saline to prevent injuring the skin even more. I'm going to assess the wound and the dressing for TACO, which is type, amount, color, and odor, and I would make a mental note to document later. I'm going to discard that, and my gloves, perform hand hygiene.
But you don't have to because that's TACO. I just want to make sure because that's all. I got that in
Put
my
on
head
new
right
gloves.
now.
Throughout the whole assessment and procedure, I will ask my patient if they're in any pain, which they're not. I'm going to get this gauze. I would make sure it's not expired, not open. And I'm going to put saline in here, clean, saturating all of them. I will use one at a time to clean the wound. From the top to the bottom. And then the outside from the top to the bottom. And the inside from top to bottom. Then I will use the same amount to dry it, starting in the center from top to bottom. Then the outer from top to bottom. And the inner from top to bottom. I will remove my gloves, perform hand hygiene, put on new gloves, now I'm going to obtain the culture. I'm going to check the packaging to make sure it's not open. I'm going to avoid touching any of the inside. I'm going to remove the cap, take out my swab, and insert it in the deepest part, saturating the tip of the swab, filling it. I'm going to put it back in the tube without touching the sides, close it up, and I would label this with my initials, 2 patient identifiers, the date and the time and the site that it was taken from, and I would send this up to the lab. I would remove my gloves, perform hand hygiene, and I would report and record per facility policy.